Healthcare is important to us all. San Ysidro Health Center has continually expanded its services to provide comprehensive health care to almost 100,000 patients. But we've learned that there are some people who drop through the safety net. We've learned that the most vulnerable, the people who are most at risk, are the very young and the very old. For our kids, it's about diabetes. According to recent data, 1/2 of all Latino children born in San Diego County, that's fully 50% of our young people, will develop type 2 diabetes within their lifetimes. What's needed is prevention. To combat the impending epidemic among our children, San Ysidro Health Center started SYHC. We teach parents and children which foods to buy and how to cook them. It's hands-on learning.
Before I went to Salsitas class, I used to drink soda and I used to eat chips and junk food. After the Salsitas class, I drank more water than I used to, ate more vegetables, and ate less junk food. I recommend going to Salsitas class because it teaches you about the right things to eat and the bad things to eat.
Its results can be extraordinary, but there's a long waiting list to get into the program. We can't meet the demand. That's because a good portion of the program is funded exclusively by San Ysidro Health Center, and that makes us worry. Without the money to enlarge the program, the epidemic of diabetes will continue, and it will affect those whom we love the most. The other group that's especially vulnerable, a community that too easily falls through the health safety net, is made up of our elderly. Who doesn't want to grow old gracefully? Yet, for some of our mothers and fathers and relatives, the infirmities of age are frightening. Families can't provide the necessary care, and the wounds created by memory loss and Alzheimer's require constant attention. San Ysidro Health Center started its first program of all-inclusive care for the elderly, it goes by the acronym PACE, a little more than a year ago. Through PACE, we care for our elderly inside their homes or at our PACE Center. We provide adult daycare, therapy, meals, even salon services and transportation. But as with our children, the need is greater than our capacity to serve. But it's something we must do, because families and caretakers need their own lives too, and sometimes they can't provide what their elderly loved ones need. But we can, and we do. At San Ysidro Health Center, we're struggling to ensure that our children grow up healthy and confident, and we're striving to make certain that our elderly can age in their homes with their families, surrounded by people who love them. We must save our children. We must serve our elderly. But we can't do it without you. Won't you help us? Please.